Okay, just in case you couldn't hear me, because my mute got muted. Uh, my my mic got muted um, on me. I didn't touch it. I didn't touch it. It just got muted. But I am actually doing a radio show right now on the mask, and it's called the Mask Hour. And what I wanted to talk about, first of all, let me say I am not red nor blue, so this is not a political show. This is just some statistics about the mask, because I know there's a lot of people that are just tired. I'm tired of wearing the mask. I am like super tired of wearing it, but I have chronic asthma and in the first stages of COPD, so I am going to try my best to stay well. So I do wear a mask whenever I go out. Now, when I'm at my office, I don't wear a mask because I work by myself. All my employees are working from home, so there is no human contact when I go out. Um, I don't believe that the virus is just like floating around out there and that it's just going to hit me, when I walk outside and with, breath of fresh air is carrying coronavirus in it. Now, I do believe if you get too close to people, then yeah, you can get it. And I'm taking all those precautions as a person who is not 100% well at all times and dealing with asthma, which I deal with. So I was reading a Danish study. They did this study between April and June of last year of 5,000 um, participants. And no, I'm sorry, it was 6,000 participants. Now, they tested them before they started this trial. And so they were all negative, before they were COVID-19 negative before the trial. Well, roughly 4,860 of these participants that finished the experiment, the results were not encouraging. The researchers had hoped that the mask would cut the infection rate by half among wearers. Instead, 42 people in the masked group, now keep in mind, half were masked and half were not masked. They were told when you go out, don't wear a mask. And then the other half was told when you do go out, wear a mask. So 42 people in the mask group got infected, compared with 53 people in the unmasked group, which was 2.1% that they did get infected. So you see, the difference was not statistically significant. And there was a doctor, Dr. Henning Bundgaard, a lead author of the experiment and physician at the University of Copenhagen. He told the Times, the newspaper The Times, the results of his research are clear. He said, our study gives an indication of how much you gain from wearing a mask, and it's not a lot. The Times notes that the research did not contradict growing evidence that masks can prevent transmission of the virus from wearer to others. And I think that's the important of the mask is you're not only doing this to protect yourself, you're doing this to protect other people too. Because what if you did unknowingly get the virus? Then if you're wearing a mask, you're not going to transmit that to anyone else. So the doctor goes on to say that there are two important things that should be noted here. He said the Times is correct that the study did not contradict evidence that suggests that masks can prevent sick people from transmitting the virus to others. But the Danish study didn't test for this, as the paper notes. Only healthy people were tested in the experiment. There weren't any sick people that were tested. Second, there was never much dispute on whether sick people should wear a mask. From the beginning of the pandemic, public health officials agreed that infected people should wear a mask to reduce the likelihood of transmitting the virus. And I agree with that. He says the masks are important for someone who is infected to prevent them from infecting someone else. And I think this is the point that a lot of people don't get. And I know there are a lot of people that are refusing to wear the mask because they are following a political party, and that's all fine and good. That's your prerogative. Um, but I just feel like people should be educated and do your own research. Don't rely on what you're hearing. Now, Dr. Fauci, he noted back in March on 60 Minutes, when you're in the middle of an outbreak, wearing a mask might make people feel a little better, and it might even block a droplet, but it is not providing the perfect protection that people think that it is. And often they are unintended consequences. People keep fiddling with the mask and touching their face. And look, I have to wear glasses when I'm wanting to read something, and I can tell you right now, when I put them on and I put the mask on, I can't wear my glasses because I can't see. So I'm like totally completely adjusting it, and I'm sure you're doing it too. So Fauci would later modify his position on that, saying he discouraged masks out of concern of a supply shortage. But he was not wrong that mask wearing comes with unintended consequences, such as people touching their face. Now, the CDC chief, Robert Ray Redfield Jr., has gone a little further than Fauci, declaring in a public testimony that this face mask is more of a guarantee to protect me against COVID than when I take the COVID vaccine. However, Redfield's assertion is not backed up by scientific evidence. As the authors of the Danish study point out, the World Health Organization acknowledges that we lack evidence that wearing a mask protects healthy persons from the SARS or the CoV-2 virus. So I know that I am a firm believer on freedom of speech, and we live in America because we are a free people. Now, we have guidelines or rules, laws that we should abide by, but a lot of people are taking this way, way out of proportion. This particular thing is not about a political party. It is about the health of the world. Now, I say this as we reach, I believe, 500,000 in deaths. And I did check the flu statistics because I think it's important. I think that we should know that there's a lot of people that have died from the flu every single year. And it's never been recognized because now this COVID has come. And I do believe that the flu statistics are going to go way down because they're going to be diagnosing people more with COVID than flu. And that is just my opinion. I don't want any haters coming at me because I'm talking about a mask. I am not against the mask. So just let me say. And, one of my friends, which I'm friends with a lot of people that own businesses, and it is their right to say, hey, if you want to come into this business, you must wear a mask. Now, I think in Louisiana, it is still, you still have to wear a mask. There is no, you can't wear a mask. Mississippi, I think, is a little iffy. Florida, I don't think it's mandatory. But I just think since there is a waiting period from when you're exposed, that it would just be a good idea to wear it, even though I hate it because I do have asthma and it does affect my asthma. Like I went out yesterday, I thought I would die before I got home. Just saying. So even though it is an individual decision, when is it going to get to where we want to be with the betterment of us as a nation? When are we going to be to where we, I hate to use the word unite because I don't see any unity in the world or in America right now. But again, that's just my opinion. and I'm getting stronger with my opinions on several things because I'm an advocate for many things. Suicide, pet. I have a pet charity. We have a suicide charity as well. So I'm an advocate for many things, but I am more of an advocate about living in America in the land of the free. I do not want my freedom taken away. Um, but I want to comply. I want us to be healthy, and I want to comply with things that will make that happen. So, um, I just encourage you to use your better judgment. There are some people out there. I mean, I've seen the Walmart fights, and this is ridiculous. This is ridiculous. One of the stores that I go to in Louisiana, they have this huge sign on the door that says, if you do not have a mask, you cannot enter. Well, how many times for years have we seen the sign that says, no shoe, no shirt, no shoes, no service? A lot, years and years and years and years and years. So, what is the difference with wearing a little mask for what, 30 minutes while you buy your groceries? And it is not anything else but to protect other people. So, I hope that my opinion helped a few little people, um I mean a little population maybe, and that's all I really care about. I hope everyone has a healthy day and to stay smiling and to stay happy.